Sepsis is a serious medical condition. It occurs when the body's response to an infection becomes overwhelming. This immune response triggers widespread inflammation. This inflammation can lead to organ dysfunction and even failure. Sepsis is a major health concern, especially for older adults. Seniors are particularly vulnerable to developing sepsis. They are also more likely to experience severe complications. Understanding sepsis is crucial for protecting the health of our aging population. Sepsis is a leading cause of hospitalization in the United States. It affects millions of people each year. The elderly are disproportionately affected by this condition. As we age, our immune systems naturally weaken. This makes us more susceptible to infections. Seniors are also more likely to have underlying health conditions. These conditions can further compromise their ability to fight off infections effectively. This combination of factors makes sepsis a significant threat to the well-being of older adults.
Our immune system is our body's natural defense mechanism. It protects us from harmful invaders like bacteria, viruses, and fungi. As we age, our immune system undergoes changes that make it less efficient. This decline in immune function is a natural part of aging. It is known as immunosenescence. Immunosenescence affects both our innate and adaptive immunity. Innate immunity is our body's first line of defense. It provides immediate protection against a wide range of pathogens. Adaptive immunity is a more specialized response. It develops over time after exposure to specific pathogens. With age, our innate immune cells become less effective at recognizing and destroying pathogens. The production of antibodies, a key component of adaptive immunity, also declines. This makes it harder for seniors to fight off infections and increases their risk of developing sepsis. Furthermore, chronic inflammation associated with aging can also impair the immune response. This creates a vicious cycle that makes seniors more susceptible to infections and their complications.
Several factors contribute to the increased risk of sepsis in seniors. Age-related decline in immune function is a primary factor. As we have discussed, the aging immune system is less efficient at fighting off infections. This makes older adults more susceptible to developing sepsis from even minor infections. In addition to immunosenescence, underlying health conditions play a significant role. Chronic diseases such as diabetes, heart disease, lung disease, and kidney disease are more common in older adults. These conditions can weaken the immune system and make it harder for the body to fight off infections. Polypharmacy, the use of multiple medications, is another risk factor for sepsis in seniors. Older adults often take multiple medications to manage their various health conditions. While these medications are essential for their health, they can sometimes have side effects that suppress the immune system. This can make seniors more vulnerable to infections and increase their risk of developing sepsis.
Recognizing sepsis in seniors can be challenging. They may not show typical symptoms like fever or rapid heartbeat. Instead, they might have confusion or altered mental status. Urinary tract infections can also cause confusion as an early sign of sepsis. Other symptoms include decreased urine output, dizziness, and fatigue. It's essential to maintain a high index of suspicion for sepsis in seniors.
A race against time. Early detection is key. Sepsis is a time-sensitive condition. The sooner it is recognized and treated, the better the chances of survival. Early detection and prompt medical attention are crucial for improving outcomes in sepsis patients, especially seniors. When sepsis is suspected, healthcare providers will typically perform a physical exam, order blood tests, and may also collect urine or other samples to identify the source of infection. Blood tests may reveal elevated white blood cell count, indicating an infection, as well as other markers of inflammation. Imaging tests such as X-rays, kinetic scans, or ultrasounds may be necessary to locate the infection site. Early recognition of sepsis symptoms is paramount. If you or a loved one experience any signs of sepsis, it is crucial to seek immediate medical attention. Remember, time is of the essence when it comes to sepsis, and every minute counts in the fight against this life-threatening condition.
Seeking help. Prompt medical attention for suspected sepsis. Suspecting sepsis, especially in seniors, warrants immediate medical attention. Do not delay seeking help if you or an older adult in your care experiences symptoms such as high fever, chills, rapid breathing, confusion, or disorientation. These could be signs of a serious infection progressing to sepsis. Reach out to your doctor, call emergency services, or visit the nearest emergency room without delay. Explain your concerns and the observed symptoms clearly to the medical professionals. Be prepared to provide information about the senior's medical history, including any recent illnesses, surgeries, or hospitalizations. Remember, early diagnosis and treatment are crucial for improving outcomes in sepsis cases, particularly in older adults who are more vulnerable to complications. Prompt medical attention can be life-saving.
Fighting back. Treatment and management of sepsis in seniors. Treating sepsis in seniors requires a multifaceted approach that addresses the infection, supports organ function, and manages the body's response to the infection. The cornerstone of sepsis treatment is prompt administration of antibiotics. These medications help to fight the underlying infection, preventing it from spreading and causing further damage. Broad-spectrum antibiotics, which target a wide range of bacteria, are often used initially while waiting for the results of blood cultures to identify the specific bacteria causing the infection. In addition to antibiotics, seniors with sepsis may require supportive care to maintain organ function. This may include intravenous fluids to maintain hydration and blood pressure, oxygen therapy to support breathing, and medications to regulate blood sugar levels and blood pressure. Managing the body's response to infection is another crucial aspect of sepsis treatment. Sepsis triggers a cascade of inflammatory responses that can damage organs and tissues.
Shielding seniors, preventive measures for a healthier tomorrow. Preventing sepsis in seniors involves a combination of proactive measures aimed at reducing infection risk, boosting immunity, and promoting overall well-being. Vaccinations are among the most effective ways to prevent infections that can lead to sepsis. Seniors should receive recommended vaccines, including the flu shot, pneumococcal vaccine, and COVID-19 vaccine, to protect themselves from these potentially life-threatening infections. Maintaining good hygiene practices is crucial for preventing the spread of germs that can cause infections. Encourage seniors to wash their hands frequently with soap and water, especially after using the restroom, before preparing food, and after contact with others. Regular checkups and screenings can help detect and manage underlying health conditions that can increase sepsis risk. Encourage seniors to keep up with their doctor's appointments, get regular blood sugar checks if they have diabetes, and monitor their blood pressure.
Championing senior health. A call to action. Protecting seniors from the threat of sepsis requires a collective effort from healthcare providers, seniors themselves, and their families and caregivers. By understanding the risks, recognizing the symptoms, and taking preventive measures, we can significantly reduce the burden of sepsis in our aging population. We must champion senior health by advocating for better access to health care, promoting healthy aging practices, and raising awareness about sepsis. Educating seniors, their families, and caregivers about sepsis is crucial. They need to be aware of the signs and symptoms of sepsis, understand the importance of seeking prompt medical attention, and know how to prevent infections. Let's work together to protect the health and well-being of our seniors and ensure that they live long, healthy lives. Remember, knowledge is power. And by empowering ourselves with information about sepsis, we can make a difference in the lives of our loved ones.